This video is about the differences between Medicare Supplement and Medicare Advantage. So I'm going to go over the pros and cons, but I also want to focus a little bit on Medicare enrollments or Medicare Advantage, the pros and cons of it. So a lot of my clients are asking me, is it okay if we are healthy turning 65? We want to first enroll into Medicare Advantage, see if it is better, and then if it is not working, then go into Medicare Supplement Insurance Plan. I say it depends. I'll paint a picture for you. You can make that reasonable decision, and there's a little bit of risk involved in it. So Medicare Advantage, if you're in a big city, you're not in a rural America, and you're closer to hospitals and a network of hospitals where you know that this Medicare Advantage plan will work and you don't travel that much, yes, you can think about a Medicare Advantage plan. You also have to be very, very transparent and truthful, honest about this issue. Like, are you healthy? Are you healthy? And did you have major health concerns before you turn 65? Do you want to take that risk? Because if you're not healthy, this is your window to get into a Medicare Supplement Insurance Plan, and such as a Plan G, and the Plan G will take care of you forever. If you pay the premium, yes, they do go up. It's a yearly premium, but you're paying upfront rather than playing this risk game where if you're unhealthy, then your out-of-pocket costs will skyrocket. You're confident that you will not pay that much of out-of-pocket costs. You are going to go with the zero premium Medicare Advantage plan that has dental, vision, hearing, over-the-counter medication, but you also have to pay for Part B premium, which is $170 for the year 2022. Yes, Medicare Advantage plan will work for you. If you're healthy, just turning 65, and you're not at a risk to get or use that out-of-pocket expenses or financially. Let's say one more thing, like you're not 100% careful about your health, or you had previous health conditions that has been very expensive, but luckily you are covered by your employer's insurance, but now you want to take a risk. I would highly encourage you to make sure, look into Medicare Supplement Insurance Plan, such as a Plan G or a Plan N, because the out-of-pocket costs from a Medicare Advantage would be high. The co-pays, the deductibles, the co-insurance, you have to understand all these are ways where an insurance company will charge you to make up for that $0 premium. A lot of my clients fall for the trap of $0 premium and they go for Medicare Advantage plan. And a year later, they say, Nash, this plan is not good. This was not what I signed up for. The marketing materials were very too good to be true, but I do want to get back onto Medicare Supplement Insurance Plan. So if you're in your 65, turning 65, initial enrollment period, you have to make a decision, because that's when 7-month window where actually no questions asked. The insurance company actually takes you in with your pre-existing conditions. And if you have some serious pre-existing conditions, serious health conditions, and you can afford a monthly premium, let's say between somewhere around $80 to let's say $160 a month, you have to think about Medicare Supplement Insurance, because that will protect you, and it's a steady monthly premium that you pay, and you don't have to worry about out-of-pocket costs. But you want to take a risk and feel good about saving some money and taking a risk on Medicare Advantage, it's up to you. But I can tell you right out of the gate, if you have some kind of pre-existing health conditions, you just turned 65, Medicare Supplement Plan, Plan G is your best option. I'm going to cover on certain things today. Those are other things that we didn't discuss. So for example, Medicare Advantage plans in an area or in a geography, they sometimes disenroll policyholders, disenroll customers because something happened, their contract with that hospital or the network didn't work for that year. So, and they actually say that we do not support going forward this hospital or this network. Let's say all your eggs were in that basket. You are assuming that, that network is in coverage this year. Is there a guarantee that that hospital or the doctors are covered next year? There's no guarantee in Medicare Advantage. If the Medicare Advantage plan doesn't cover that, then that is considered to be an out-of-pocket expense. And if you don't understand that out-of-pocket expense can run somewhere between $5,000 to $11,000 based on the plan, based on where you are from a Medicare Advantage carrier and plan perspective. PPO plans are slightly less expensive than HMO plans. So that's the biggest risk there. Now, I'll give you some examples here. Let's say few of us who are actually watching this video, they know how great is Cleveland Clinic, Mayo Clinic, MD Anderson in Texas. So these are world famous and Johns Hopkins in Maryland. These are world famous hospitals, right? These are world famous hospitals. Have you noticed, have you seen on their website, they also sometimes don't take Medicare Advantage plans. And I'm not making this up. I'll have a video. I'll prepare a video, review that. I'll show you the top 10 major hospitals. Some of them don't take Medicare Advantage plans. Some of them take a plan that is actually made by their own hospital network. So if you're in that hospital network plan, you're eligible. If not, they don't take it anyone from external. So if that is the case, then why people still go with Medicare Advantage plans? I would say it's just cost and lack of understanding. Cost, because they fall for that $0 premium. They don't have to pay upfront anything. Okay, you don't pay upfront anything. That's great. You don't pay a monthly premium. As long as you're healthy and you don't go to the hospital, you're well off. But after turning 65, things will not be the same. A health issue will not tell you that I'm coming to you in few weeks' time. Health issues appear suddenly. And when it happens sudden, it's going to go south pretty fast and your expenses will go up pretty soon. So are you prepared for that? If you have, let's say $20,000 saved for your out-of-pocket costs, out-of-pocket expenses, go for it. Go with the Medicare Advantage plan. I can ask you, do you have any money saved for your out-of-pocket expense? 9 out of 10 Medicare Advantage folks say they don't have any, they can't even afford, like let's say $2,000 procedure or something like that. Now, if you don't have those out-of-pocket expense costs saved, then it will be a problem. Some of my clients have mentioned that they're going to dissolve their 401k or retirement savings to pay for out-of-pocket costs. Okay, fair enough. I want you to look into my eye and say, look into your 401k policy today and tell me how you're doing with this market and economy and inflation, because not a lot of people, some people have lost money. Some people are still in the, in red due to the stock market. And now let's say I ask you to pull the money out. You're actually selling your investments at a lower price to feed your out-of-pocket expenses through Medicare Advantage. So that's where I'm asking, it's going with Medicare Advantage for healthy people makes sense. But for people who had some kind of health conditions, it's a financial risk that you're taking. You have to be aware of it. Let's say you had the money. Let's say you had $20,000 and you want to pay for out-of-pocket cost. And think about it. Is that the right usage of your $20,000 to pay for out-of-pocket costs, or go with the Medicare Supplement Plan Insurance, which is Plan G, and pay monthly? Think about which one is the best way to use your money. Now, I want to leave you with one more thought. For example, both Medicare Supplement Insurance and Medicare Advantage do not cover cancer, do not cover expensive chemo, do not cover expensive cancer drugs. Have you thought about taking a cancer or a supplemental cancer policy? I have done a video on supplemental policies and especially cancer and the drugs they're so expensive. There are few drugs in cancer treatment that actually cost you around $10,000 to $15,000 a year. Now, Medicare Advantage will not cover for that. And those $15,000 have to come from somewhere. Are you going to liquidate your 401k for that? Or are you going to go and, take out of your savings? Instead, having a small cancer plan or cancer policy will definitely help you get the best treatment possible. So there are certain financial moves that you have to make when you're thinking about Medicare Advantage and Medicare Supplement. So these are some of the things that you have to think carefully about, because Medicare Advantage, on the face of it, they look great. It's a no-brainer. It's a zero premium plan. Why don't you take it? It's actually, if you read the coverage document, you understand what co-pays you have to pay, what co-insurances you have to pay, what deductibles you have to pay, and then the out-of-pocket costs. That will skyrocket once you hit that threshold. And even worse than that is Medicare Advantage plan is not taken or not approved in some of the top hospitals. Some of the top hospitals say we don't handle Medicare Advantage plans. But if you're on Medicare Supplement Insurance and Plan G, every hospital in the country, 99% of them actually take them. So think about, you're saving money monthly, but you're actually going to lose big time if something happens. Now, if you want to play that risk game, go for it. But as a well-wisher of your health, as a well-wisher for my clients, I want to bring this forth in front of you and say, this is the apples to apples comparison. On the paper, Advantage looks great, but it's not that great when actually you're sick and you need coverage. So that's why I'm saying, if you're really into saving money, so think about Medicare Supplement Insurance. Actually, this is one of my clients who told me, and I'm not making this up. She said, Nash, a lot of people think Medicare Supplement is you're paying a premium. monthly. But what she told me is very important. She said, Nash, I'm paying monthly so that I don't owe money to the hospital. I don't owe money to the doctors. I'm actually paying for myself. The premium I pay for Plan G is actually protecting me from owing money to these insurance companies and to these hospitals. So once I pay $100 a month, I can sleep peacefully. Whatever happens to me this month, my Plan G will protect. Whereas think about someone else who is just on Medicare Advantage, hoping, wishing that they don't feel sick that year because their out-of-pocket costs will go skyrocket. So this client actually opened my eyes to how she thinks about Plan G. She says, I pay $100 to $150 a month to not pay the doctors extra, to not pay the hospitals extra. This is how I keep my sanity in check, and I'm very happy with this plan. So this is the most fundamental difference between Medicare Supplement Insurance and Medicare Advantage. Nothing wrong with Medicare Advantage if you're young, healthy, 65, and can play that risk game. But if you're really unhealthy and you don't have any resources or assets to protect yourself from those skyrocketing out-of-pocket costs, you don't want to get into Medicare Advantage plan. You have to think about it. And also, if you want to go to other specialists nationwide, you can't go through Medicare Advantage. They have restrictions. So you don't have freedom.